So the name itself is very important. We're nutrition and exercise physiology, not or. Our curriculum from undergraduate level to the graduate level blends both of those disciplines. And I think that is very important because nutrition and exercise are the cornerstones of health promotion and disease prevention.
So I think the most important thing that NET brings to the table is it's very much nutrition and exercise. It doesn't focus on one or the other.
Definitely having professional training and experience in both of those areas is really beneficial and also really marketable, I found. Working in different internship locations, it's just helped me to have a little bit of an advantage and a little bit more to offer, like my preceptors and my supervisors, because I can provide insight in exercise when they can't, or I can provide insight in nutrition when they can't.
We give our students the tools to address both of those disciplines so that you can treat patients more holistically.
There's a clinic where the people can come in, and so we work out with them. We do a bunch of exercise testing, nutrition testing on them, and then work out with them and actually like build that relationship.
I decided to do a non-clinical route, so working with individuals preventative-wise. So being a personal trainer and then having the nutrition tools, and then also a behavioral component as well, so people can make those long-lasting, changes. So they can either come to me with fitness, concerns, or they come to me for nutrition, but hopefully I can integrate those both and help people meet their goals.
This new relaunch of these degree programs are going to allow students to really take a deep dive into clinical and more population-based research on nutrition, physical activity, and exercise, and how those areas of research apply to either clinical practice or improving the public's health.
The key point that distinguishes WSU from a lot of other institutions is that this is a land-grant institution. So one of the things that we can do that others can't is we can take, for example, food that's grown by WSU professors and right here in Eastern Washington, look at its nutritional content and then get it to actual human participants and test that to see what kind of health benefits it has. So not many institutions can do that. So we really are taking this soil to society approach.
With a coordinated program, it blends the academic preparation and the supervised practice training. The students are issued a verification form, and so they get the opportunity to write for the examination, which is not like many of the other programs that are either a didactic program in dietetics or a dietetic internship. So a coordinated program has both in the training, and that's really important.
We can have all these tools and education and knowledge of how to help these individuals, but in the classroom it's a lot different in real life settings. So being able to have these internships and all these different experiences through the internships and different styles and approaches of how we can help these individuals really helps people realize that they need to seek stuff out for themselves.
We've been developing relationships with the data center at the Spokane Health District, who conduct countywide surveys on the health and physical activity and diet of Spokane residents. And they collect a wealth of data, and because of our partnership with them, these kinds of studies that are being conducted by the health district can be analyzed by us and our students and would be wonderful opportunities for research.
The biggest thing that sold me to come to this campus was I knew I would get to work and be around students that weren't just a part of my program. So I've worked with pharmacy students, I've worked with nursing students, with health policy administration, with the speech and hearing. I've worked with all sorts of different students.
We now are working hand in hand with physicians who are going to be treating patients. So this kind of interdisciplinary education helps our students grow. It helps the medical students grow, working in with the nurses, folks in the School of Pharmacy, Speech and Hearing Sciences. We have a complete team approach to treat the patients. We have a kind of a seat at the table in terms of our department, folks who are establishing the medical school curriculum can reach out to us, and we can provide expertise on topics where diet and exercise have an influence on those. Any kind of system, cardiovascular, GI, you name it.
And that program is shaping me to care for my future clients, teaching you to have relationships and care, and giving you the science background that you need to make an impact.
The NET program it's just an awesome community, and I think that it sets you up really well with relationships with other people who are really like-minded as you. We're kind of all a big team, and we all want to work in really similar field, and we have really similar passions, and so it's been a great experience just coming in and feeling like, yes, like these people understand